Hello, Space Coast. I'm Isadora Rangel at Florida Today. In recent weeks, we have heard news about the recent rise in coronavirus cases in Brevard County and across Florida. And I assume that, like me, you have a lot of questions about what is going on and what this means for you and your family when you're trying to protect yourself. So today, Florida Today is going to try to answer at least some of those questions that you have. And I have two experts who are joining me today, and they're going to try, and we're going to do our best to get all of your questions answered. Don't forget to ask them here in the comments section if you're watching this on Facebook. But let me begin by introducing our experts. And they are going to give us a local outlook of what's going on as well as more of a statewide. So I'm going to start by introducing Dr. Nick Moradi. He is the Medical Director of Critical Care and Pulmonology at Melbourne Regional Medical Center. Welcome, Dr. Moradi.
Isadora, thank you so much for having me.
And Dr. Jay Wolfson, he is the University of South Florida Distinguished Service Professor of Public Health, Medicine, and Pharmacy. Welcome, Dr. Wolfson.
Glad to be here.
So we also were supposed to have a third expert with us, Dr. Ochoa at Parish Medical Center. But unfortunately, he's not able to be with us today. So I want to begin by asking a very simple question, and I think it might seem very simple, but there is debate about what the answer is which is we're seeing a rise in the number of cases. How serious is that to you? And specifically, if you can tell me what metrics and indicators you are looking at when you're trying to assess this situation.
Sure. Would you like to go first, Jay? Or do you want me to?
Please, Nick, yeah.
Sure. So in hospitals right now, we're seeing a significant uptick in the number of positive patients and number of hospitalized patients. But we're not seeing an associated increase in severe symptoms or increase in mortality. The population seems to be younger. And although some are admitted to the hospitals for short or long periods of time, we are seeing the gross majority of patients recovering and being discharged home. So that means that, yes, this is kind of an intimidating time where we're having this huge uptick in our numbers and our diagnoses, but we're not seeing that same associated severity of disease where people are extremely sick and dying from the disease as much as we saw earlier on and localized to the Northeast.
Dr. Wolfson.
Yeah, we're seeing the same thing throughout the state, and that's both good news and disturbing news because, as Dr. Moradi knows, and as many of you as well, while the age grouping is dropping, that does not mean that the infectiousness of the disease is changing. So many young people are getting the illness. Some of them are coming to hospitals. We're seeing an increase in the 18 to 35-year-old age group coming into the hospital, but for shorter periods. The great news is that they're not having the kinds of acute episodes, but they still can pass it on to their parents, their grandparents, their aunts, and their uncles. So we have this is still a waiting and watching game as we move forward.
And by the way, I'm seeing a comment here about why wasn't Health First invited. Actually, they were, but they did not have any experts available today. So I just want to make sure to let people know about that. But I'm going to ask the next question is that, so we're now seeing younger people in the next 2-3 weeks. Could we see a rise in other age groups? Because obviously, like you mentioned, Dr. Wolfson, younger people can get other people infected. Is that something that we can expect will happen? And if that does, what does that mean in terms of, our hospitals and our capacity?
Again, I think that's part of a waiting game, and Dr. Moradi is really on the very front line of watching that. So he sees things that aren't even reported in the news, and that the hospitals don't generally report. And what we do watch is, the rates of positivity, and then the rates of hospitalization, which follow, and then the rates of ICU use that follow after that, and then, of course, the death rates that may follow after that. But Dr. Moradi is, again, right in the front line. He has a better finger on the pulse today.
Dr. Moradi, what are you seeing? I mean, obviously.
Well, I'm seeing that Jay is very much a gentleman to be pointing all these things out for me, and I appreciate that. Thank you. What I'm seeing in terms of we're having that age group, that 18 to 35 age group, have this huge increase in incidence. And we have to keep in mind some big picture things when we look at that number. So we're seeing a big increase recently, but keep in mind the first few months of this disease, we had very limited testing, very limited types of tests. The number of tests were very limited. most people, we were saying, if you have mild symptoms or no symptoms, stay home. Don't come to the hospital. Don't get tested. Stay home and you'll get over it. And that was pretty effective. And I think that's what a lot of that age group did. But now, we're further on down the path. Many different companies have started mass producing different types of tests. There is a huge increase in test availability. So now people are getting tested much more frequently. They're getting tested repeatedly. The same people in the community can be tested 2 or 3 times, depending on their specific scenario. So we have to keep that in mind, that maybe we were underdiagnosing it previously, and now we're getting much more accurate numbers, or closer to accurate, in terms of how much this is really affecting us. And another point to keep in mind when we're addressing this same question is people aren't getting as sick from it. So yes, we're diagnosing more people, but that doesn't necessarily mean that all of these people need oxygen, need ventilators, need all the scary things that comes along with that diagnosis.
That's very interesting. I'm actually curious to know what kind of symptoms and the severity of symptoms are you seeing compared to the first wave, when we were seeing a higher median age of people infected?
Sure. So a quick note about that. It's interesting because everybody thinks about COVID as an upper or lower respiratory tract disease, whereas there are some studies that show up to 60% of people present with actually GI symptoms, nausea, vomiting, diarrhea, things like that. So we really have a long way to go in terms of how we understand the disease. Now back to the question about severity of disease and what's the outlook for these patients. Well, there seems to be a wide spectrum of disease severity that we're seeing. Some patients can be discharged directly from the ER or urgent care to go home and just monitor their symptoms. And if, let's say, they develop shortness of breath or things get worse, then come back to the hospital. We can check to see if they need oxygen or further therapies. Other patients are admitted and they improve and are discharged within 2 or 3 days. And then there's another subset of patients where they might need to be intubated. They might need mechanical ventilation, and they might end up in the hospital for up to 6 weeks. The takeaway point that I would look at is that even in the very sick patients that require an extended recovery period, we are still seeing these patients survive. We're still seeing patients being able to be discharged back home to a normal life. And forgive me because I speak very bluntly and very upfront. We weren't seeing that in the first wave, which affected the Northeast greatly. And we were seeing a lot of people get sick from this, go on the ventilator, and they did not survive to make it out of the hospital. So it's kind of a different type of wave that we're dealing with right now.
Is it an age difference or pre-existing conditions? What is making the difference here?
Well, that seems to play a role. The COVID-19 virus, it affects everybody differently, just like any infection. And the age plays a big role, and your comorbidities play a big role. If you're 20 years old and have always been healthy and you get COVID-19, it's likely that your symptoms are going to be very mild, and you might not even notice that you had COVID-19. Whereas if you're 80 years old and you have some very severe comorbidities like diabetes mellitus that's uncontrolled, hypertension, hyperlipidemia, you might have had strokes before, it's much harder for you to find that functional reserve to fight off the infection and bounce back from it.
Wow. And we're actually getting a lot of engagement here on Facebook. And I actually spotted a really good question from Summer. She says, being pregnant during this time is scary. Should pregnant women be taking this more seriously?
I'd say, what do you think, Jay? But I would say, yes, it is a scary time. Being pregnant, yes. Be scared. Extra precautions, yes. Anything.
Absolutely.
If you have a grandma or grandpa's visiting from wherever, be extra scared. Take that extra precaution. Don't go out if it's not necessary, if we're worried about that. What do you think, Jay?
Agreed. That's from all the data we're seeing nationwide, Nick. That's one of the newer predicates to taking extra precautions.
Good. I'm glad you said that. So now I want to talk about the latest news about COVID-19. The World Health Organization says the coronavirus is spread mainly through droplets from someone sneezing or talking, and apparently they fall very quickly to the floor. But now 239 experts have signed a letter to the WHO saying that, hand washing and social distancing are good, but they're just not enough. And they say there's enough evidence that the virus could be airborne, meaning that it's spread through, I believe, smaller particles that stay in the air. That sounded very scary to me. How serious is that, and what does that mean for how we protect ourselves?
Florida,
what do you think, Jay?
Florida Atlantic University, Nick, just last week came out with a great study. Our engineering colleagues at FAU showing the droplet nuclei spread through aerosol, and they'll shoot out 12 feet, and they'll stay in the air between 3.5 and 6 minutes, depending on the flow of air in the room. So these are real serious considerations. It's not just sneezing and dropping on the floor. This stuff stays in the air for quite a while, and it spreads a broad distance and hangs in the air again, depending on the ventilation. And there's an interesting calculus that we look at, and that is proximity and congestion and time. So the longer you are together with lots of people in a congested area, the greater the likelihood that somebody's going to sneeze or cough or scream or yell or even just talk loudly. And that's going to project the droplet nuclei into the air, and it will cause them, especially with a sneeze or a cough, to hang in there for quite a while. And you're going to be exposed to it. So wear a face mask if you're sneezing or coughing.
Dr. Moradi, you want to add anything?
Sure. I think that was an excellent, spot-on explanation by Jay, and it really simplifies kind of the science behind it. That the longer you're in close contact, I mean, I can't say that any better than Jay did. I can speak a little bit more to the finer details of it, in that we're still learning how this virus functions, and we learn almost daily. Like Jay alluded to, there was that recent study that it can project 4 feet, whereas we thought it was 6 feet, and it can last up to 3 to 6 minutes. There was one study that was very limited that came out, I think, in February, that said maybe it lasts up to 3 hours in the air. I can tell you, as of right now, what is kind of accepted in the health community, and there are studies underway to help us understand how it works and how it spreads. But for now, our guidance is that the virus is spread by droplet. So respiratory droplets, they spread disease because the droplets themselves are a little bit larger. And when the droplet comes out, it usually falls to the ground. Maybe it's within a few seconds, maybe it's within 3 minutes. And how far does it go? Maybe 12 feet, as per that study that Jay was speaking about. Now, airborne is different than droplet. Airborne particles are usually much smaller. Usually they're relatively dry, and they last in the air much longer. The drying process often damages the pathogens, and the number of airborne diseases that we're currently aware of is pretty limited. Things like tuberculosis and, things like that are, I mean, there's really not that many that are airborne that we know about right now. So if we find out that this COVID-19 is airborne and airborne for a long time and still remains that virulence, that would be a scary thing, but that's not what people are saying right now.
Okay. And just so if COVID-19 is airborne, so that's just so I can wrap my head around it, means, so if I am in a room and I have COVID and I am, say, talking, exercising, and then I leave that room, and then somebody else walks into that room, that means that they could catch it, even though I am not in that room anymore, depending on the time lapse between me and that person being there. Is that what that means?
So I don't know what you think, Jay. What I would say is yes, that's what that means, but that's the question we don't know. Okay. Is it airborne? And if so, how long does it last? Is it 3 minutes? Is it 3 hours? Yeah. Is it different per person? Is it different in terms of what substrain it is? There's so many questions that we don't have the exact answers to.
Got it.
What do you think, Jay?
Well, and as Nick said, almost every day we really do learn something new about how this virus works, and it's usually bad news.
That's right. Whatever it is usually scarier, and it seems like the scarier the story, the higher up on the feed it goes.
Yeah, and then we're getting some really good questions from viewers. Danielle is asking, how accurate are the COVID antibody tests right now? Is it worth getting one at all?
Nick, what are you seeing? I got stuff that's going on in China and Europe, but what are you seeing in the States?
So, the big question that I've had at both my facility and I assist with all of our sister facilities in the region is, okay, so let's say the antibody test is great. They've been doing IgM and IgG, and just for the viewers to know, classically, IgM is indicative of more of an acute to subacute phase of the infection, and the IgG is a sign that you were previously infected, because it takes a couple weeks to form those antibodies. Now, the real question that we're struggling with is, okay, so if you get an antibody test and it doesn't follow the rules, IgM doesn't tell you it's acute, subacute, IgG doesn't tell you you're protected, what are we doing with the results of the antibody test? I mean, let's say you've had COVID and now you know you've had COVID. What does that mean? I mean, there have been some studies that have come out of Wuhan and some other areas that show people are getting reinfected with COVID. And the reinfection usually ends up the patients ending up worse and having more severe disease than the first time they got infected. And how come some people don't get reinfected? I think it's important for the viewers to know that when you've been infected with it, it has not been proven yet that gives you immunity from it moving forward. So when you get an antibody test, let's say it's positive, does that mean you're free and in the clear? From everything that I've read and I know, the answer is no. So then, what do we do with that information?
Dr. Wolf, you want to add anything?
And that's so important, Nick. You hit it spot on. The issue of conferred immunity, what we don't know is whether even if you've had a demonstrated acute episode of the disease, whether or not you have immunity going forward for 3 months, 6 months, a year, 2 years. And for people who are tested for the antibody, there are all kinds of time zones. I mean, I could be exposed yesterday, get tested today, and I could test negative today. I won't even know that possibly for 5 or 10 days until I get the test results. And I could test tomorrow and test positive because of the way the virus works in my system. And I understand there's a time period between the acute period and the antibody buildup period where I may not be testing positive at all. And there are so many different test brands on the market, and the FDA has just increased the sensitivity requirements for the IgG. They finally made those very specific today. I've been working with some of my colleagues looking at what the FDA does. And some of the test kits that are on the market, please be wary. Things are being sold on the internet. They're being sold at various drugstores. People are hawking them all over the place. And some of them are not FDA approved. Some of them have not gotten an emergency use authorization if they're coming from another country or even from here. And if you use it, especially after the acute phase, you can't be guaranteed that the result is going to be good. There are things called false negatives, and some of the tests have been withdrawn from the market by the FDA because they were fraudulent. So just be careful which tests you're using, and remember that if you get tested today on some of these things, you may not know for a few days unless there's a rapid test kit that gives you information within 15 minutes, and we're all hoping there'll be more of those available very soon and that they'll be very reliable.
That's it. That's good to know. I got a lot of questions about the drugs being used to treat COVID-19. And one of them specifically was asking about the drug remdesivir. I think I said it right. I'm sorry. Might be my Brazilian accent. So is it available to physicians treating COVID? And this person who asked this question, Molly, said, I have been told by physicians that Florida is tap town, which is extremely disturbing. Is it commonly used?
Yeah, so if it's okay with you, Jay, I'll start off with this one. So there have been a handful of proposed treatments and therapies that seem to show promise. We're utilizing them and trying to keep up to date evidence as it emerges, as we strive to always follow evidence-based practices. I think it might be too early to safely say one therapy works better than another. I can say that the therapies that have good quality evidence behind them to show benefit are steroids, specifically dexamethasone, 6 milligrams a day, and remdesivir, which is the one that your viewer Molly was alluding to. The patient population that show the benefit are a patient that comes in and they're pretty sick and need a little bit of oxygen, but they're not so sick that they need a ventilator yet. And I believe the reason behind that is you don't want to treat people that have such mild symptoms that they're going to get better on their own in a few days. You don't want to give them these potent medications in those scenarios. Now, if you catch a patient that's getting a little bit sick, but before it triggers something called ARDS, acute respiratory distress syndrome, that's kind of the sweet spot, because once you trigger that acute respiratory distress syndrome, that's kind of all bets are off, and it's very hard to stop that train once it starts rolling. I understand the viewer Molly said that it is very difficult to get remdesivir. I know that in my hospital system, we still have it and are still utilizing it for the appropriate patient population on a case-by-case basis. So I'm not sure where she got that information, but I haven't heard that in our system or a couple of the other major hospital systems in Florida that I try to keep in touch with.
Dr. Wolfson, anything you want to add?
No, Nick's got it.
Thank you, sir.
We also got quite a few questions about hospital bed capacity. And Dr. Moradi, if you can speak about what is your bed capacity right now? If you don't know the exact numbers, that's fine. If you can give us an estimate, I'm going to put you on the spot like that. But how is capacity? Do you feel good about at least your hospital's capacity right now?
Sure. So I work with Steward Health Systems. We have 3 hospitals in the Florida region. We have seen a huge uptick in hospitalizations and the necessity of resources over those last 4 or 5 days, and really over the last 2 or 3 weeks as we've seen the incidents increase. But the July 4th weekend was a big one, especially because Miami closed all its beaches. I think it was similar in Fort Lauderdale, so everybody kind of moved up the coast to still enjoy some beach time. We still are not at capacity or critical capacity. When all of COVID started, we created a platform in terms of how to, on a day-by-day and even hour-by-hour basis, be able to adjust on the fly for where we're seeing incidents, what we need, resource allocation, things like that. So as we saw the incidents increase in Florida, our nationwide partners in the same health system reallocated resources to Florida so that we could help support that. And I think that that's going on at all the major health systems across the United States. In terms of our specific health system in Florida, we still have plenty of space. If you're sick, get out there and go to the hospitals. If you need to be seen, be seen. Take care of yourselves. And that's really the message that I think is important to get out to the viewers.
And we're looking at what's happening in Texas, where they're pretty much at capacity. And I think a lot of people are scratching their heads and wondering, why is that happening in Texas? And why are we seem to be in a much better situation here in Florida when it comes to hospital capacity? I don't know if either of you can answer, why are we in such better position? And the second part of the question is, could we end up like Texas in the future? Or do you have that concern at least?
What do you think, Jeff?
Well, I think part of it is Texas opened up a little bit earlier than we did, so they had a few weeks advanced opening and more folks spreading than we did by about 2 weeks, I believe. So they've got a head start on us. And they were far less vigilant than some of our cities were, especially in South Florida, in requiring social distancing and masking than we were. So we had more time than they did to protect ourselves. And in South Florida in particular, I think we did a better job at the local level mandating social distancing and protections than they did in Texas.
Yeah, completely agree with Jay. I think that's a great way of reviewing.
But Dr. Wolf, does that mean that they are a couple of weeks ahead of us, and that we could end up in the same spot? Or do you feel that we have done a better job to make sure that doesn't happen?
I think in South Florida, we've done a very good job, much better than in Texas and Arizona and Phoenix. But that doesn't mean that those numbers won't still catch up with us. Nick is seeing an increase in the bed utilization for COVID patients, which means that those are displacing other hospital patients. And what we don't want to have happen is what happened in both New York and now in Houston and Phoenix, where the hospital beds are being overwhelmed with just COVID patients, and they're having to push aside cardiovascular patients, orthopedics patients. We don't want that to happen. So if we're careful in Florida and we continue to control what we're doing, and as Nick said, we have some treatments now that we didn't have before, and we're doing things that are more effective now. So we keep people out of the hospital when we can. And if each of us can exercise that degree of social responsibility and discipline, if we do get the disease and stay away from others and isolate, we have a much better chance of controlling it by looking at what's happened in places like Houston and Arizona, where there has not been that discipline, responsibility, and self-control.
Yeah, that's very good. And then we also getting a lot of questions about contact tracing. That seems to be a really hot topic with our viewers. Tracy is asking, actually it's two questions. What is the main cause for spike in cases in Brevard? I don't know if you know exactly the answer for that. And are we doing enough contact tracing and quarantine? and maybe not specifically for Brevard, but maybe what have you observed in terms of contact tracing in Florida? And by the way, the agency that would be best equipped to answer that question for Brevard would be the Brevard Health Department. We did invite them to this town hall, and Administrator Maria Stahl was not available. So, but let's try to, at least based on what you have observed, how well are we doing contact tracing?
Nick, are you?
So I think I'll
involved in
let.
that?
What was that? Okay.
Are you participating in any of the contact tracing management activities?
No. I notify the Department of Health, but I will say, if I can just preface before Jay answers, I think that Jay nailed the answer to this question with his answer to the last question. I think that's the biggest takeaway for our viewers. Everything that Jay had stated about being kind of cognizant of yourself, your surroundings, and your people, and not going out in large groups, because that is how this is spread. When everybody was on lockdown, it did a tremendous job in decreasing the incidence of COVID. And we're not saying that we need to go back to lockdown, but it really becomes a personal decision where if everybody in the community can just kind of educate themselves as to how this works, how it's spread, things like that, and avoiding large gatherings, that seems to put a big dent in this. So that would probably be the biggest takeaway. And I suspect if we look back at the epidemiology of it, somewhere along the line that was lost in these cities that are getting hit the hardest in terms of people being out in large groups and this being kind of a sequelae from that.
Yeah, so contact tracing is an old public health technique. We've been using it for hundreds of years, trying to kind of backtrack the source of infection and find out what the source was, all the way to the water pump in cholera. And what happens is, if you are testing positive, then you will be asked for all the places you've been, the people you've been in contact with over a period of time. And it's very important that you share that. And then the health department, in collaboration with local resources, some of the local medical schools and medical students and public health schools are getting involved in this. They will get on the phone and they will call people, or in some cases they will knock on doors, which is a bit more dangerous. And it has not been as successful as we would like. But even if you get a 10% or a 15% success rate in identifying people who have been exposed to someone else in a place, and you can help them understand what they can do to reduce the risk to them and to their family, we can begin to continue to push that curve down. So it's a very resource-intense activity, and we don't have the political and cultural system in this country to do what's being done in China, in South Korea, and parts of Europe, where they're using people's cell phones without them knowing it and tracking them. That's not something that we've found acceptable. There are some voluntary systems, but the goal is to get as much detail as we can about the texture of the landscape of this disease wherever it's breaking out, so that we can know what it's looking like, and when there's a hot spot, we can go in and put the fire out before it turns into a forest fire and we have to shut the whole state down again.
Wow. And another quick question about hospitals. I'm seeing there's some chatter about some questions about whether patients are being moved from out of county hospitals or from one hospital to the next. Dr. Moradi, is that something that you have any knowledge that might be happening?
I do, actually, yes. So in our health system, we have a cohort plan in place where our tertiary care facility that has the most resources is where our COVID patients are going, so we can kind of standardize treatments. It's the same physician leaders, the same nurse leaders, the same staff leaders that are taking care of COVID patients, because there's a learning curve to it, and they're on the top of that learning curve. So we have been transferring our COVID patients to that specific center now. The first time that there's been a transfer of patients, non-COVID patients, from that center happened during this July 4th weekend. Because it was getting so busy, we wanted to make sure that everybody stays safe and stays taken care of. And we, instead of having long waits in the ERs and things like that, we had patients that, instead of waiting 10, 12, 24 hours for a bed from the ER, the patient was getting transferred to two of our other facilities that are within a few minutes transport away and being cared for there, and then discharged directly from there.
Great. I know I have a couple of questions about just what I call practical questions. The first one that comes to mind to me is groceries. Early in the pandemic, I would wipe down every single produce grocery that I purchased. I've stopped doing that, but should people do that? Is that can I catch COVID-19 from my cereal box or from my produce that I just purchased at Publix?
Probably not. I think caution is still helpful. If somebody's delivering your groceries and if they're coughing on them or sneezing on them, you might want to wipe them off before you bring them into the house. But you're likely not going to catch COVID from your cereal box. It probably won't last that long on the cardboard. So just, again, exercise prudence. This is common sense at this point now, even though we are learning more about this disease.
Yeah, I totally agree with Jay. I think it's important for the public to remain informed. I think that everybody should be doing their own research, deciding what level of precautions they think is appropriate for themselves and their families. I think there's a lot of unbiased information out there, specifically on the internet. And if the people can stay personally informed, they can make those kinds of decisions on to what lengths they want to go to protect themselves. But I agree with Jay, it would be hard to just pick a box off the shelf that's been sitting there and for that to be
a lot of work.
Yeah.
I actually want to know personally, what are you two doing to stay safe? What are some of the things that you do that you have added to your daily routine?
Nick is staying unsafe every day.
Yeah.
I was about to say, you nailed it, Jay. I've been working every day for the last few months. So I'm either in the hospital working at one of our 3 sites or at my site in Melbourne Regional Medical Center, or I'm home sleeping and getting called and waking up and going back to the hospital. So it's relatively simple for me. Put on mask at work. I have my plethora of masks that when I'm not in my office, I am donning usually 2 at a time, depending on the patient population. So it's very simple for me. So I will throw that back to Jay.
Well, I'm very concerned about Nick and all of our frontline caregivers because even though they don up and they have lots of stuff, they're exposing themselves every single day. And if somebody slips through and gets them sick, it's really going to be horrible for us. So I try to exercise extreme caution. I'm over 60 years old. I'm a stroke survivor, and I've had pneumonia 3 times in my life. So I'm a 3-time loser, I guess. I'm at extremely high risk. I stay at home with my wife, and if we do go out to pick up groceries, we double mask. We don't interact. My own sons don't come to visit us at home. They stay in the driveway. Until we know more about this, I'm being very cautious. I'm teaching online. I'm taking care of all of my administrative activities online. All of our clinical conferences, all of our budget conferences are all like this. And that's really the new world order. But for people like Nick who have to see and touch patients, you can't quite do it easily like this. I have a bit more of an advantage because I can do most of what I do like this, and I'm doing nearly all of it this way.
Wow. And there's a big debate going on about masks. And obviously it's a debate that has become quite political, but would you speak as experts? Should you wear a mask or not? And do you when you're out in public?
Yes. Wear a mask whenever you're around other people. If you're walking alone on the beach, you probably don't have to wear a mask. But if you're approaching a crowd, or if you're in any congested area where there are 3 or 5 other people within 12 or 15 feet of you, you should wear a mask, get into the habit of doing it. It's to protect them. You're being a responsible citizen, and you're being respectful of them, and you hope they do the same for you. So it's better to wear a mask than not to wear a mask whenever you can. And you're seeing a lot of people driving with masks on. That's because they're not touching them and taking them on and off, which is probably a good thing to do to protect themselves.
Dr. Moradi.
Yeah, that's a great call. Great call, Jay. I agree. The masks only help. There's really not much downside to wearing masks other than sometimes it's uncomfortable or it gets stuffy, but they do help prevent the disease transmission. And like Jay said, if you're alone walking on a beach, enjoy the air. But if you're going out somewhere and it doesn't hurt, it's a personal decision. But from everything we see, it is probably the number one thing in terms of prevention, that and hand hygiene and prevention.
And actually, my follow-up question is, okay, wearing masks, obviously, I think we're all on the same page, wear them, but then taking them off and then disposing of them. What should I do if I wear a cloth mask? Should I just put it in the washer as soon as I get home? I leave them in my car because I try to leave them in the sun. Am I doing the wrong thing and putting myself at risk by doing that? Tell us, how to take it off and how to throw it away or wash it or whatever.
Well, some masks come with instructions. and follow the instructions. If you're wearing a plain bandana, a cotton mask, wash it out like your socks. You wear your socks, you wash them the next day. If you're wearing a disposable mask, dispose of it. Some people are having difficulty getting a hold of masks. You can wash some of the ones you may have in a mild detergent and let it sit in the sun to dry. Again, this is fairly commonsensical stuff. Make sure you have enough that if you need one in your car, it's there, that you always have one available for you. And that if you've been sneezing on it or coughing on it, or if it's gotten really dirty, if you can't clean it up, get rid of it, because it's probably not doing other people any good if you can sneeze right through it or cough right through it, and if others can get it. And sometimes you lose the protection around the rims as well, which is where most of these masks fail.
Interesting.
Yeah, I think Jay nailed it. If you, at the end of the day, you should do something with the mask. You should either clean it, or if it's a disposable, dispose of it and get another one. If you're sneezing and coughing so much that it gets moist throughout the day, that's the time to take it off and get a new one.
And there are some questions about the virus possibly mutating. I don't know if you guys are able to answer this, but this is coming from Nick. The CDC previously stated that the mutation of COVID-19 was minimal and low risk, yet we're seeing more additions of symptoms and how it affects people. Is there any concern of it further mutating symptoms?
So I think that mutating a virus that mutates is different than the way that it's affecting our bodies. Yes, we're seeing that a lot of people are presenting with GI symptoms as opposed to presenting with respiratory symptoms initially, but that doesn't mean that that wasn't happening before. It just means we weren't noticing it before. Keep in mind, this is a novel virus for us, and we're still trying to figure it out. We're still trying to figure out how it works, what it affects, what body system it affects. And keep in mind how many hundreds, thousands of viruses are out there. A lot of viruses lie dormant in all of our body systems at all times, and they don't really come out until we're immunosuppressed, whether that's medically or due to some other disease process. So viruses are around. Viruses do a lot of different things in different people. So to say that, the virus is mutating more aggressively and that's the reason for the GI symptoms, I wouldn't link those two things that quickly.
Agreed.
And now I want to explore, kind of brainstorm about what our new normal should be moving forward. The governor has said it time and time again that he is not shutting down the state again. So, which means, at least to me, that we're going to have to figure out a way to stay open and protect people and lives. What are your thoughts? How do we go back to normal without obviously hurting the economy? Any thoughts on how to do that? And how do we even do this? Is it possible to return to normal without risking new infections?
Well, Isadora, we don't have a vaccine yet. And when we do, we'll have a vaccine very likely, and it may likely be useful for the lowest risk populations. It takes years and years and years and years and years to develop a vaccine, because you give somebody a shot of something and then 3 years later they can have an adverse reaction. So vaccine, we don't have a vaccine. We don't have a good treatment yet. And we don't even know if herd immunity is possible, because we don't know if it confers lifetime. So for the time being, whatever normal is undefined, because we still don't know how this virus is going to affect us 3 months from now, 6 months from now, or 3 years from now, if it's still around and we haven't found anything. No, we still haven't found the treatment, a vaccine for AIDS, but we've gotten fabulous treatments for it. So the bottom line for now, for all of us, is we can't afford to close down the economy. We can't afford to get people losing more jobs, businesses going out of business forever. Divorce lawyers are having a heyday. Domestic violence is increasing. Bankruptcies are increasing. When we come to the fall, we're going to be experiencing another round of regular influenza. The 17-year locusts are coming in the fall as well. It's an election year, and we're going to have hurricanes. For the next 6 months, this is going to be a tumultuous climate, and there's a lot of uncertainties. The only certainty that we can have is within ourselves, and it's taking responsibility for our daily behaviors, wearing a mask, washing our hands, exercising good hygiene, being respectful of other people, and just exercising common sense. which is the most important thing. There are no politics here. There's only good medicine, good public health, and good common sense. And if we recognize that, then this becomes like a Smokey the Bear thing. Only you can prevent COVID.
Dr. Moradi, would you like to add anything?
I would like Jay to patent that catchphrase because that sounds perfect.
The forest people got it already with Smokey the Bear.
That's right. I think that Jay nailed it. I mean, I was going to mirror his exact same sentiment. It doesn't take a governor to shut things down or mandate this or that. There is personal accountability. We're all community members. We all live and work with each other. The important thing is that we kind of know what helps, what works. And we can function as a society. We can function together. We can go out and do business and do all of these things, but do it in a somewhat more protected way, at least for the time being. Wearing the mask, not gathering in large groups, all these kinds of things. Everything that Jay said was dead on. I mirror that sentiment.
And I got a really good question here from Jamie. Do you think it is safe to fly if wearing a mask? I think a lot of people are probably wondering that. I am wondering that myself. My whole family lives in Brazil, and I feel I won't be able to see them for the next 2 years because I do not want to sit on a plane with a mask for 8 hours. But if I'm wearing a mask, does that mean I'm safe on a plane? What is your educated guess, or if you know that?
Isadora, it depends in part on your risk factors. I don't think I could take a risk because of my health risk factors of flying on a plane. I'd be much more susceptible to the slightest thing. My resistance would go down, and then I'd go down even further. For other people, if they have to travel these days, if you wear a mask and protect yourself, you know yourself better than others. I think it's still risky. The airlines are opening up. They're putting people 3 to a seat, which some of us in public health find curious, at least. There's no risk-free environment, but you don't have to go out of your way to create more risk, unless you have to.
Dr. Moradi, want to add anything?
Yeah. So I think that there are 2 parts to the question that you asked, and I think Jay addressed the first part, which is what's the risk to the person flying, and that has to do with your comorbidities. And should you catch COVID, how risky is it for you to catch COVID? You have to assess that risk day-to-day basis, and depending on who you are, what comorbidities you have, things like that. The other part to your question was how risky is it to catch COVID? And I think that a lot of different factors play that role when it comes to flying. How busy is the airport? How many people do you have to pass in close proximity to? Do you sit next to somebody on the plane, or is it just you on the plane and nobody else is on the flight? Sitting 3 to a seat, that is an interesting approach that the airlines might be having, especially when everywhere else we're doing social distancing of 6 feet. And, if you go to a fast food place or something, everybody's spacing out tables, restaurants, things like that. So I think there are way more factors that make it fall kind of into the gray area in terms of the question of whether it's safe or not. I think the one thing that I can safely say with confidence is if wearing a mask on its own protects you 100% from everything while flying or otherwise, I think it is safe to say that is not the case, that just simply wearing a cloth mask protects you from everything COVID related is not an accurate statement.
Wow. Which Nick just asked something about masks, and maybe you can expand a little on that. It said, if you can't acquire or afford an N95 mask, which are obviously hard to come by, what do you believe is the next best alternative, or is it simply user's choice since any mask is better than none?
Any mask is better than none. Multiple layers are better than one layer. Quilted layers are better than plain cotton. And and where you're going with it is important as well. If you're in a mildly congested area or a lightly congested area, you can probably get away with a bandana or multiple sheets of cotton. If you're going to be in a very congested place, flying on an airplane, for example, standing in line in an airport, a much more effective mask, an N95 mask, is going to be what you want.
Yeah, anything is better than nothing, and the more the better. When this thing first broke out in China, I was reviewing some documents and I was looking at pictures and things, and very, very innovative. people, they took those big jugs that you use as water filters, and they cut, when it sits upside down, they cut the top off and put that over their head. And that worked almost as like an isolation chamber for their breathing, and very functional, and it worked, especially in an area that's as densely populated as Wuhan, China, all these places. So the thicker, the better, the more layers of protection, like Jay said, the better.
That's very interesting. Not sure we're going to see a lot of that here in Florida, especially being so hot. But I have a couple of more questions here, and then I promise I'll let you go. Angie's asking your thoughts about opening schools at full capacity. How should we go about reopening schools? Should we do it at full capacity? Should we? I've heard some school districts are doing stacked days, or where you go to campus maybe 2 or 3 times, and then the other 2 days you stay at home. What are your thoughts on that?
We're all struggling with this, and every school district is developing a separate plan in this county, and the state is attempting to provide some general input. But for the most part, it's really locally controlled, both in the K to 12 and even at the university level. And there are really several issues here. As we learn more going forward in the next few weeks, if the disease progresses substantially, God forbid, we'll have to pivot again and figure out how we're going to manage this. If we send our young children to school so that their parents can go to work, we'll have to find a way to place them in areas where they're not close enough to each other to infect one another if someone is positive. The greater risk, as well as the teachers and the staff in the schools, they're going to have to be there. So we're all talking about some form of pivoted approach to education. The youngest students are going to have difficulty learning at home. They're likely going to have to be, if they're going to go back to school, they're going to have to go back to a location so that their parents can go back to work. The older students and the college students, we're working all kinds of creative plans to do that. Spaced classroom times, going into late evenings, early mornings, a combination of actual time and video time like this. And we're going to have to learn as we go with this because, we've never done it before. But we do know that for the higher learners, for high school and above, this kind of venue really works. And we're going to have to rely upon it more and more for those things that don't absolutely require presence in the classroom. For the younger kids, it's going to be a challenge.
Yeah, this is a very complex issue. And I think Jay touched on some of the most important points. And, just thinking, all right, let's say that we keep the schools closed for the younger crowd, K through 12. Parents need to work. It puts a tremendous strain on families and the teaching and the spending time and who's watching. And let's say that the schools are closed, but then you put your kids in daycare. I mean, what was the point of all that? They're still getting that same exposure. So it's really a tough situation because it's so complex and there's no easy answer. And as with all the difficult decisions I have to make in the day-to-day practice and critical care and, working out at these hospitals, I'm glad that's not one that I have to tackle.
And two more questions. One for Dr. Moradi. Jane is asking, can you address the PPE situation at the local hospitals? Are we adequately protecting our healthcare workers here?
So I can't speak to all of the healthcare systems, but I know that for my healthcare system, which is Steward Health Systems, we do still have adequate supplies of PPE. We still have backup supplies. We have, like I said, we have the infrastructure in place now where we are addressing the COVID on a daily basis. And wherever the COVID incidence is surging and wherever we need the resources at that moment, we're doing a great job of being able to redirect resources there. The state has been helpful, and I've also been in touch with colleagues that in leadership positions for HCA hospitals, and my understanding is it's the same there. They're also able to keep up with the PPE need. I can't speak to any other hospital systems because they don't have any interactions there.
And Dr. Wolfson, someone was curious about double masking, and Marilyn is asking for clarification. Can you explain how that works? What kind of masks do you double, I guess?
Well, you could put 2 bandanas on. You can take even the 3-ply blue devices that you see a lot of people wearing. Just wear 2 of them, string 2 of them around your ears, or put two cup masks on your face, just to give you extra filtration. What you're doing is you're tightening up the amount of space that droplet nuclei have to go through in order to get out or others to get in, which is less of an issue.
Awesome. Well, I think this is it. Dr. Moradi and Dr. Wolfson, thank you so much for joining us today. You guys were great and so much expertise. I'm sorry, we got a lot of questions, way more than I anticipated from viewers. I tried to get to all of them. And I'm sorry if I couldn't get to yours specifically. You can email it to me at Rangel@Florida Today. I would forward to Dr. Wolfson and Moradi. I'm sorry, putting you both on spot. And I'll try to get you answers. But thank you so much again for joining us, doctors. And this was very, very informative. And I'm sure it helped a lot of people.
Well, Isadora, thank you very much. And Nick, I want to give special thanks to you. You are a superhero. You are not just a physician providing care. You are providing care to COVID patients. You are right in the thick of it. And please stay healthy.
Well, thank you so much, Jay. That means the world to me. Just, one thing a month gets us through, working 24 hours a day, 7 days a week. And it's, it's not me. At every hospital you go to, there's a huge team of people, and every one of them are heroes. The secretary that you meet on your way in, the technicians, the nurses, the radiology techs, the administrators that help keep the place running. I mean, really, this COVID has been a tremendous opportunity for us to, I don't want to get on the soapbox and say sacrifice, but to show, what we do best and to have the opportunity. I lead a lot of our huddles and meetings at these hospitals, and it's amazing that something like this can happen. And as healthcare workers, we have the opportunity to really kick it into full force and help people. And that does come with an element of risk, but it's a risk that we're all willing to accept to provide for our community and help them in this time. So I appreciate you, Jay and Isadora, both inviting me to join in this town hall so that we can talk to the community and address some of their questions, and also address how appreciative we are for all the healthcare employees that are going to work every day, knowing the risk to themselves, knowing the risk that they bring home to their families and all that. So very much appreciated.
Awesome. And thank you to all healthcare workers. By the way, Marisa said, thank you for mentioning radiology techs. Again, if you want to read more about our coverage of the coronavirus, go to floridatoday.com. Please consider subscribing so we can continue to do the high quality work that we do here. Just go to floridatoday.com/subscribe. And thank you once again.
Be safe and be well.
Thank you, Isadora. Thank you, Jeff.
Bye, Nick. Be well.
Bye.